Capgras delusion is a psychiatric disorder in which a person has a delusion that another person in their life has been replaced by an identical imposter. It is classified as a delusional misidentification syndrome and can occur in acute, transient, or chronic forms. The delusion most commonly occurs in people with paranoid schizophrenia, but has also been seen in people with brain injury and dementia. It is also seen in individuals with a neurodegenerative disease. It is named after Joseph Capgras, a French psychiatrist who first described the disorder in 1923 in a paper on the case of a French woman who complained that corresponding doubles had taken the places of her husband and other people she knew. It was historically considered a purely psychiatric disorder, and the delusion of seeing a double was seen as a symptom of schizophrenia. Because the female-to-male ratio is approximately 3:2, it was seen as a purely female disorder and symptom of hysteria, aka women were crazy. No one knows for sure what causes the delusion, but today it is seen as a neurological disorder and is commonly associated with Alzheimer's, schizophrenia, and brain lesions. Approximately 15% of those diagnosed with Capgras have Alzheimer's. It is believed that Capgras syndrome is also associated with the frontal lobe because it has been linked to reduplicative paramnesia, which also affects the frontal lobe. A 1984 study by R.M. Bauer suggested that there are two pathways to face recognition, one conscious and one unconscious. Going off of this, in 1997, Hayden Ellis and his colleagues published a study of 5 patients with Capgras delusion and schizophrenia and confirmed that although they could consciously recognize the faces of people they knew, they did not show the normal arousal response. In fact, they showed the same amount of arousal for strangers as for people they knew well. Andy Young has theorized that this means that patients with the disease experience a loss of familiarity, not a lack of it. In 2010, William Herstein expanded on this and said, "We represent the people we know with 2 parts, one external and one internal. Capgras syndrome occurs when the internal portion of the representation is damaged. Basically, they look the same on the outside but seem different on the inside." There is no definitive way to diagnose the Capgras delusion. Diagnosis is primarily made on psychological evaluation of the patient, who is most likely brought to a psychologist's attention by a family member or friend believed to be an imposter by the person under the delusion. Treatment has not been well studied, so there is no evidence-based approach. Healthline.com states that treating Capgras syndrome involves treating the underlying causes like schizophrenia or Alzheimer's in order to remedy the delusions. This can be done with therapy with the support of antipsychotic or memory loss medication.